This is my clinical analysis on Ariel from The Little Mermaid. Ariel is a 16-year-old mermaid princess who lives in Atlantica, a kingdom under the ocean. She is the youngest of the 7 daughters of King Triton. She is adventurous and curious about the human world. This is Ariel's Big 5 personality profile. Conscientiousness. Being conscientious means being organized, careful, or vigilant. Ariel is not all that careful when performing her tasks. She is somewhat hasty when taking her decisions. She did not think twice when Ursula offered to turn her into a human in exchange for her voice, knowing that she would not be able to communicate with her prince. Extroversion. Being extrovert means being excitable, social, talkative, or expressive. Ariel is an expressive and extroverted person. She is outgoing and social, full of energy, and always ready for new adventures. Agreeableness. Being agreeable means being kind, sympathetic. Ariel is a nice young girl full of life, warm and friendly to all merpeople. Neuroticism. Being neurotic means showing signs of sadness, moodiness, or emotional stability. Ariel does not show any neurotic tendencies. She is not in a negative mood for long periods of time. Most of the time she seems happy, except for the time when she seems unhappy with her life of being a mermaid and wants to become a human. Openness to experience. Being open means being adventurous or creative. Ariel is definitely open to new experiences. She is not afraid to get close to humans, although her father has forbade it. She is not afraid to exchange her voice with the witch Ursula in order to become a human. This is a psychological disorder which I am diagnosing Ariel with. I am diagnosing Ariel with an obsessive-compulsive disorder known as dysophobia. This disorder is more commonly known as a hoarding disorder. It involves a chronic difficulty to get rid of personal belongings despite what little value or use they might have. These are the 2 symptoms that Ariel has shown throughout the film. Persistent difficulty discarding with or parting with possessions, regardless of their actual value. Ariel is extremely attached to her human artifacts, despite having no knowledge of what their function is. She makes up possible ways in which she can give use to these artifacts. She collects them and hides them in her secret grotto, where only her and her pet fish Flounder have knowledge of. Accumulation of possessions and clutter. Hidden in her secret grotto, Ariel has a huge pile of treasures. These treasures, as she calls them, are useless human artifacts she has found in her adventures and explorations of sunken ships. Missing symptoms. Ariel portrays most of the symptoms for this obsessive-compulsive disorder except 1. Social impairment. Although Ariel seems to have all of the symptoms, there is one that she does not present. Her hoarding does not seem to cause distress or social impairment, because in the film she seems very sociable and interacts with other merpeople and fish. Possible treatment. My treatment plan for Ariel's hoarding disorder is the following. Psychotherapy. Ariel could subject herself to psychotherapy. This would involve talking to a therapist or another mental health provider who has previously treated a hoarding disorder. This intervention to treat a hoarding disorder might help Ariel to explore why she is compelled to hoard. She might learn to organize her possessions and can declutter her cluttered grotto. Medication. If I had to prescribe medication to treat this disorder, the only medication I would recommend are antidepressants. These antidepressants are called selective serotonin uptake inhibitors, which can increase the level of serotonin in the brain. I believe this treatment to be very appropriate because once Ariel accepts that she has a problem, she will be more open to talk about it and will want to find a solution to treat her disorder with the help of a health provider. The projected outcome of this treatment would be that Ariel would get rid of all the things that she doesn't need, she would give away or return them to where she has found these items. There are no ethical concerns about this treatment. This treatment will not cause any negative side effects. Psychotherapy will only help Ariel talk about her problem, and taking antidepressants will help her suppress her need to collect useless stuff. The psychological disorder that Ariel possesses is accurately portrayed in the film. It shows clear proof of Ariel's symptoms and persistent difficulty discarding the possessions and accumulation of clutter. It clearly shows how Ariel collects useless stuff and places them all in her grotto, and how she will not get rid of any of her treasures because she has become sentimentally attached to them. She is intimately attached to these artifacts because she is fascinated with the human world and wants to know more about it. She will collect things she finds in ruins and sunken ships with the idea that they are marvelous when they are simply useless trash. The portrayal of the hoarding psychological disorder that is shown in the film influences the way people think about psychological disorders in real life. Because based on the symptoms and actions that the characters take in the film, people will make assumptions and auto-diagnose others based on the symptoms portrayed in the film. This has been my presentation on my clinical analysis on Ariel from The Little Mermaid.